Good afternoon, everybody. So my goal today for next 18 minutes to keep you awake and entertain you. That's it. And I'm not a neonatologist. Let me just tell it up front. I'm not a neonatologist. And it's a little bit oxymoron to teach kindness to pediatricians. Really? Because we always tell the students, oh, the pediatricians are the most kindest people. I don't know about neonatologists. I'm just kidding. I'm just kidding. Let me just tell you the story who I am briefly, you get an idea, and then we'll have entertainment for the next 12, 15 minutes, whatever we have. So I did not grow up here. I'm a FOB. All right, you didn't get the joke. Thank you. I am. Doesn't look like I'm going to go well. So I came this country in 1992, February 8, Philadelphia Airport. I was a board-certified general surgeon. And in February, the match was already done, and I was looking for a job. So I said, anything available. The only thing was available was transitionally a rotating internship in Philadelphia. I took a job, and I thought I knew everything. The first day of internship, and this is a true story. I'm not making it up. First day of internship, I go to the floor. As a transitional year, you are a pretty much H&P machine. You just do history and physical, and put the order, whatever the attending tells you. So I walk into the room and ask the patient, hey, what happened? What's wrong with you? The patient said, I passed out last night. Now, you have to understand this a little bit. Where I grew up in a British culture, passed out or passed away means you're dead. That's what we think. And here I'm saying, okay, this patient is still alive and awake. So he's not something going wrong. Now, I'm pretty much, India is English-speaking school, English-speaking country. So I said, okay, let me take more history, like nausea, vomiting, diarrhea, usual stuff. So then patients say, oh, I passed out, and after I threw up also. This was really a curveball. Now, remember, now I can see what is curveball it is. I grew up in a cricket environment. In India, we don't say threw up. We said puke or vomiting. So I didn't know what was a threw up means. Literally, I looked around the room and say, hey, what happened here? What do you threw up? Nothing is broken in the room. What is wrong here? So that's a second curveball or a second, or you call second strike. So now I'm said, okay, gee, this is really trouble. What are you going to do here? So I walk out of the patient's room and I talk to the nurse. The nurse was pretty good and said, listen, I think I have a problem here. I thought I understand English, but I just can't figure it out. And this is the nurse told me and said, Vijay, don't bother me. I have a bad hair day. Now, I look at her hair, pretty well groomed. Literally, it was very well groomed. And I had a lot of hair 25 years ago. So I said, this is not going well. So it's very interesting. On the very first day, I thought I speak everything, I understand everything, and I just did not how to figure it out and navigate, right? So now, after 25 years, I'm trying to think people and say, okay, what difference we have to teach differently or think differently? So all these years, I've been teaching my students more about compassion, right? Compassion. And then now I said, we should teach about kindness. So let's move on a little bit and then have some understanding and see what it is. But before I go to compassion and kindness and make it a little bit easier, everybody, at least in the United States, only thing on everybody's mind is burnout and well-being, right? So if you have a residence, and there are a lot of residents, none of them fellows were pretty happy. I was pretty surprised. None of them looked burnout, so good, kudos. They knew all that medicine, and Dr. Kochia entertained them well. So the well-being, I truly believe that you cannot get the well-being or prevent burnout unless you find joy caring for the patient. I can't tell you more than that. You have to figure it out yourself, especially younger people in the room. You have to figure it out, how to find the joy. Now, in your case, there is always two patients. You know that. I don't need to tell you, right? The one patient doesn't speak, right? Doesn't matter. The other sitting outside really matters, right? Really matters, right? So unless you figure out how to find the joy, you're going to struggle. And you can do some meditation, you can do yoga, you can do whatever you want. But till you find the joy, it's not going to help you. So for me, and I will really tell you, the only way you're going to figure it out, find the joy, taking care of whoever is in an incubator and the people sitting outside in solarium, the family member. You have a 2 patient all the time. And we also have, I'm internist, we have also the 2 patient. So it's all boils down to caring, right? It's caring, it's not treating. So let me there are 3 principles I have used in my life where I use for the learner and I use for the patient. Same principle, 3 principles. Number 1, I listen to them. I listen to the learner or I listen to the patient, right? Equally. Now listening to the learner is a little bit different, right? Because most of the time you are listening with judgment all the time. Especially learner, you have to make a judgment. Whether he's doing good because I have to fill up evaluation. But sometimes you have to listen to the learner and a patient without non-judgmental. We're not going to have a time to talk about what is non-judgmental. I'm sure you will figure it out. But active listening, non-judgmental listening for a learner and the patient is the same. Number 2, you really have to care for them. Care for the learner, care for the patient. It is not treating. I still remember one of my professors have said, Vijay, you walk in any patient room, and this is absolutely true, and it's these days true. Within a 30 seconds, now not your patient in incubator, but the patient who's sitting outside in a solarium, the parents will figure it out in a 30 seconds, and it's blink on your forehead. He's here to treat my baby, or he's here to care for my baby. Absolutely, the family member will figure it out. We do have that intuition, all of us. I'm sure anybody who have been in the ER ever in your life, you knew this ER doctor is there to treat you or for care for you. Caring is matter. So just one, I'll give you, all these years I've used caring for my learner. Anytime I meet a new student, I never start the conversation about academics or a culture or whatever they want to. I will know that student. This is my standard speech. And I said, okay, you're going to tell me next 7 minutes about your life story. And the life story will be, this is like standard, I'll say. Where you were born, where were you raised, where you went to the high school, did you do fun in the high school, where you went to college, what was your major, did you take a gap year? And you came to the medical school, what did you do for fun in medical school? Live about your siblings and live about your family and what you do outside the medical school for fun. That's pretty much. You tell me that, and I have a notebook, because I talk to a lot of students. Every student, I get that information. Now, on the day of graduation, I forget their names, but I do remember some interesting, unique story about those students. I will never forget that. So the student knows that I care for them. Try this, talk to the student before even diving to say, you didn't do well. Let me give you feedback, right? The dean's office say, you better give a student a feedback and say feedback. Care for them. And a third thing, which is applied equally same for a learner and a patient, is once in a while, go extra mile. We all need to go extra mile for our learner. We need to go extra mile for a patient. An extra mile means, which is something not in your job description, right? Most of us do exactly know how to deal with the job description, right? We always do, but you do something which is not a part of your job description. Do something extra which is not a part of your job description. So I don't know in neonates, but in adults where I practice in Camden, New Jersey, getting a glass of water when a patient is buzzing the buzz and trying to alarm and get somebody, the medical assistant, to just get a glass of water. The geriatric patient who could not open the can of the box of the milk for a pour in the milk on a cereal, just do it there. Simple extra step, extra mile. So at the end of the day, listen to them, care for, go extra mile. Pretty much, you might get in teaching award. I will tell you, I don't know any medicine. But I did all these three, and I got pretty good amount of award. So that's a well-being. But let's dive a little bit deeper, how we achieve a well-being by spreading and talking or giving a kindness. So let's make it simpler. Most of you maybe know, so if you already know, that's fine. Sympathy is pity towards somebody. Most of us, and this is, I tell my medical student, taking history and physical, don't use word sorry very loosely. We do all the time, oh, sorry for this or sorry for that. 95% of the time, we don't mean even anything for that sorry. You should only tell sorry. I tell my residents and I tell my students, unless you screwed up, you made a mistake, you hurt somebody, you harmed somebody, absolutely you need deserve sorry from that family. Family deserves sorry from you. That's a true apology. But just doing sorry or showing a sympathy, not worth it. Compassion. So I think the question a lot of people get confusion between empathy and compassion. What is the difference? If you had to ask you, what's the one difference, one sentence difference between empathy and compassion? Empathy, you know, right? We say, oh, empathy is a really emotional response. Consciously, you try to understand what's going on that person going through, right? That's what you're trying to understand. That's empathy. Last 25 years in the United States, in a medical school, we've been teaching empathy. You fill out the paper, Jefferson empathy scale, all the scale is all about empathy. We say, oh, they come in the medical school, they have a lot of empathy, they become fourth year, they lost empathy, and by the time they become an ICU fellow, NICU fellow, it's gone, it's evaporated. No, I don't know that. But compassion, in a simplistic way, empathy plus action. Empathy, you don't have to show any action. You have to show that you have intention, or at least try to alleviate somebody's suffering. That's compassion, right? In our profession, empathy alone is not enough, right? In medicine, you just can't say, oh, I can imagine what you're going through. That's not enough. We have to show some compassion that at least you attempt, right? You may not be able to fully cure or fully alleviate their suffering or illness. We all should try to have a compassion. So that's compassion. So now, why I'm talking about today kindness. So what's the difference between compassion and kindness? Is there a difference? Or I'm just making it up for another next 15 minutes and try to convince you. So let me make you understand. Compassion is usually people or person in front of you is going through some sort of a distress, right? Most of the time when you say, I'm going to use a compassion, that I'm going to alleviate your suffering illness. Kindness is just any benevolent action through you to any person without emotional attachment, right? You and I can show kindness anytime, anybody. You can show kindness to anybody, anywhere, right? And that person in front of you doesn't have to be in any distress at all. That's a kindness. Now, in medicine, all these years, now people talk about kindness. If you look at Harvard Business Review and Oxford have a lab called a Kind Lab, there are PhDs spending years and years of research thinking about what kindness is and why kindness is important. In a current environment, in medicine also, I really believe that our learner and we all are sort of in last 25 years driven to just show a lot of compassion or empathy. Actually, empathy was the main reason. Compassion was not even though many of us did the empathy plus action, but the kindness is not enough shown, or we have not, right? Now, anybody have any question about this four difference? Sympathy, sorry, no meaning. Empathy, emotional response, connection, that I can understand what you're going through, right? Compassion is empathy plus action to alleviate, and kindness is some action to help people in any form, and the person in front of you doesn't have to be in any distress, right? That's simple as a kindness is. All right, so there are random way we can show a kindness, right? So let me give you an example. This is what I've done I practiced general internal medicine when I was academic medicine. In Camden, New Jersey, I don't know how many of you knew Camden, New Jersey. If you remember all these years, if you say 5 city, which is always a crime for last 25 years, St. Louis, Oakland, California, Camden, New Jersey is always there. That's what I practiced for 23 years. A lot of my patients are poor. Many of these are homeless, drug users. All these patients come, and my residents, and I have randomly shown sometime kindness, and my residents get upset. So I'll give you some example. Like patients say, the patient is already know that he is a drug user, patient is ready to discharge, patient say, I don't have money for a bus or a taxi, I will take out $5, $10, and I give it to him. My resident completely get pissed off and say, not pissed off at me, Dr. Raj, what are you doing? He's just going to buy a bag of heroin as soon as he walks out of the hospital. I said, but I don't know that. And you also don't know that. Oh, no, we are 100% sure because he's going to come back. And I said, it is okay to once in a while show that random act of kindness, right? I always have a challenge, and some people say, Dr. Raj, the hospital administration is going to give you sometimes slap on your face that you are giving money to the people and encouraging their drug habits. I don't know. I have done it. I don't know whether that's right or wrong. In same example, all the time, if you take in your hospital, and any pediatrics, neonatologists, they're just born. But my patient at any time, 1 or 2 in the hospital have a birthday that day, if you think about it. And if there's somebody on my service, is having a birthday that day, whether it's a dementia patient or any patient, I will give her a $20 to my residents. Now you have to be careful, because you give a resident $20 student, the student dean will complain that you're abusing student, making your work, and getting him to get the cake from downstairs from cafeteria. Serious. The school here is crazy nowadays, right? I'm one of them. So, but you give her a cake, you bring the cake, celebrate the birthday. Patient will just say, that's not happen often, right? So I'm just trying to give you some example. Just show some random act of kindness. Sometimes it doesn't even need money, right? We just need somebody to just feel that you care for them, right? And we only do that many times for the patient or a caregiver, and don't show it generally to the other people within the healthcare system. There are paper after paper. I'm not going to bore you, but there are paper all the way will tell you that any rectament of kindness actually help you, your well-being, your pleasure, you name it, and then you will get better, right? And these are all pro-social behavior, right? There are pro-social behavior which help people. And people are talk all the time that anything, Harvard has to do a longer study to figure out the only thing help you to live longer is a more relationship, right? You know that, right? That's I don't need to tell you, you know that. So if you be a kind, all this will help you. And I really mean, and I think I really want to send a message that a lot of time our well-being is connected really people whom we work with, and also the caring we provide to the patient, whether they're in incubator or a family outside. If you take care of them, it's your well-being also get improved. There is no question about it, right? So we already know this. I can't tell you. Even the person who's receiver also get quite a lot of benefit, and the person who's giver get a lot of benefit. So there is a good amount of benefit. Everybody gets it. There was a New York Times article teaching kindness in a medical or in a elementary school and in a curriculum. And there are data to show that really help also. And I already told you about celebrate new learning. Throughout my career, anytime if my students or residents help me to make a diagnosis, I will take them out for ice cream or a coffee downstairs in the cafeteria. It cost me $15, $20, but it gave me a lot of teaching award. I'm not kidding. Do you think I know medicine? No, I didn't know medicine. All right, so so the kindness is important, right? Kindness changes everything. So before we go to the the civility business, let me just spend a few minutes to get some other important message. In our country here, lately, our kids, all of us, use the word stress. You hear the word stress all the time. I'm stressed out, or you hear the word anxious all the time. So let me make it clear, and this is not there was an article maybe 5 years ago in New York Times. There's a difference between word worries, stress, and anxiety. Our generation, not but my kids will, anything goes wrong, they suddenly get anxious or suddenly they're stressed out. So let me make it clear for you, different between. We all should, if you have a concern, the word we should use and tell our kids that I'm worried about you, or I'm worried about this situation, or I'm worried or concerned. We should not use the word stress that often. So what's the difference between a worry, stress, and anxiety? Quickly. The worries is just a psychological response or a cognitive response, not even a psychologically. Brain tells you that you should be concerned about or worried about it. That's worry. You shouldn't be worried for a small things, because that's a normal physiological cognitive response. Actually, it's a healthy, right? There are called eudaimonic response are pretty healthy. The word stress we use commonly in our country all the time, and our kids and everybody, is actually abnormal physiological response to the cognitive stimulation you got about the worries. And you don't need to convert all the stress, the cognitive response, into the stress. Stress is physiological response with a sweaty palm or a tachycardia or anxious. That's stress. And every time somebody in front of me says stressed out, not showing any of those features. Now you can say, oh, usually chronic stress people don't show it. I agree with you. Anxiety is abnormal response. But we, in our culture, we have some sort of merged those three words so closely that every one of us, the word anxious or anxiety is like loosely used commonly. I'll give you an example, right? Like if I said order a pizza and I order for my kids with a pizza and the pizza guy got a wrong pizza, my kids will say, gee, this stressed me out. How can a wrong pizza should stress you out? Doesn't make sense to me, but kids will say they do. And same thing with anxiety. My message to you, your kids at home and you, start thinking and not use word stress and anxiety loosely. Next time when it comes up in a situation, just say, I'm worried or I'm concerned, right? All right, do I have a pinky promise from all of you that you're not going to use word stress and anxiety loosely as our kids use it? I'm serious about it. It will help you. It will help your well-being. All right, so let's spend another 5-10 minutes. This incivility. We are in a very developed country. We are very civilized, pretty well dressed. But what is the problem? Why suddenly civility is becoming a big problem in healthcare? It was always a problem. But now it has got a little bit more into the challenge. A physician, and it's a vicious cycle. If you are stressed out, and this is truly stressed out, then there's a vicious cycle that you are likely to show your emotion in an abnormal way or a wrong way around surrounding people. The civility or incivility problem is across every organization. It across the healthcare, in the nursing, and the health profession. And I will show you some data and I will explain you. But incivility, to me, there are three major, I call it 3M, right? There are 3M which leads to, one is called micro-incivility, right? These are not obvious. These are subtle, inconsequential behavior towards somebody else, where usually you can sort of say, oh, no, I really didn't mean it. Many times, all these 3M, and which I'll tell you what these 3M, all are in the eye of the beholder, right? It's many times like a pornography, right? Somebody say, oh, no, that's not pornography. Looks fine. But other person say, no, that's a pornography. Same thing for this 3M. It's in the eye of the beholder, right? In the eye of the beholder means the person who receiving feel that I've been outcasted or I've been not valued or you don't care. So what are these 3M? The one I already told you, micro-incivility, right? This micro-incivility is subtle, small. There's a tons of list, and you have experienced it or you might have delivered to somebody. That happens. The other 2M, which we don't think about it in our profession, is the one is I call micromanaging people, right? In our profession, it's pretty common, right? Micromanagers are all over the places, right? And excuses in our profession is a lot of time, it's very easy to say, oh, it is a quality and patient safety. That's why I need to micromanage. Whether it's your NICU fellow or a nurses, you will take away from the nurses or a fellow because it's a patient. And I'm not against it. If truly patient safety issue or a quality issue, but I will tell you, many of us just don't have that stretchable zone of safety surrounding us that we feel comfortable allowing the NICU fellow or a nurses to do that. Micromanagement is a big challenge. We don't realize it, but most of the time, I'm sure you know that, and you know yourself also, what is your stretchable zone? When do you jump in to do or care for people and not taking the chances, right, with your fellow? And I want to make sure that I'm talking to all the NICU faculty. I don't want to come out here and say, oh, no, let's just give everything to the fellow, and the fellow is making all the mistakes. No. But there is a need. The micromanagement does hurt. And it is, again, in the eye of the beholder. So you have a micro-incivility, you have a micromanaging people, and there is a tons of literature. Just the literature, we have wrote a few papers on micromanagement in a healthcare for the last few years. But a lot of literature has been a Harvard Business Review and a management journal. They've been talking about micromanagement for a while. In our profession, it's there, but we always have excuse because there is always a third person. In other part, there is not much third party there. A lot of time in a business or anywhere else. Here you have a patient, right? So we have a reason to say, oh, we need to worry about it. And the third one, you know that, and we all have been talking for all these years, for at least last 10 years, and we've been talking more and more about it, is a microaggression. So microaggression started around maybe Columbia's guy wrote a paper about it. Initially, a lot of was connected to the racism and an issue of prejudice and stereotype. But lately, the microaggression, again, you can sense it. It's always in the eye of the beholder. So how are we going to figure that out? I think what I'm trying to make a point here about this micro-incivility is find the way that we all can minimize. There is no easy way you are going to say, oh, I got a nirvana, I did a meditation for 2 days, I went to somewhere and learned about, I'm not a micromanager, I don't do microaggression, and I'm not a micro. It takes time. At the end of the day, only message I have, teach kindness besides compassion, all right? Make sure your learner understand, and not always think about figuring out where we can make it some sort of impact on micromanagement, microaggression, and micro-incivility. But thank you all. I didn't get the time, or was amount of time left. But thank you for listening, and this was my first time to talking to neonatologists. Thank you all.